Good afternoon, everyone. It is Ala Talat again. We are here with our colleague from the radiology team. I think she's taking a photo of something here, but we have Mrs. Joanna York, our consultant radiographer. And what do you want me to call you?
Call me Joe.
Joe is one of our team in the breast department. We are working among two hospitals. I'm not going to mention the hospitals. And she's responsible about all the symptomatic and also screening patients in these two hospitals. And today she's helping us to spread the word about breast screening in the Middle East, and especially Egypt, especially my city called Al-Minya, which is the bride of Egypt. So we have here my colleague and assistant, Ms. Aman Pervez, and we have our other colleague, Samantha Cole. I don't concentrate on surnames, but she's cool. So first question, Joe. Why do you think today, as I mentioned, we had a very busy clinic. We found 3 cancers out of 15 patients came with symptomatic clinic.
We did, yes.
And we discussed that the age start to get lower.
Yes, it does.
Is that correct? Yeah.
It does appear we see more cancers that are in younger women, whether that's due to early detection and people being more aware of breast cancer, but we are seeing it.
What about screening? Why would you think about screening here in UK?
So we screen in the UK because breast cancer is the most common form of cancer to kill women in the UK. And over 12,000 women a year can die from breast cancer in the UK. So we have early detection with screening. With screening, we call patients and we can find cancers before a lump can be felt, and the cancers are very small.
This program started early, I think it starts from mid-60s, is that correct?
No. In the UK, breast cancer screening didn't start until the late 80s.
80s, but yes. There was a report coming from...
We had a report from St Patrick Forest.
Yes.
And that came about because there was screening already in Sweden.
Okay.
So we looked at Swedish trials, and that's how we adopted breast screening in the UK. So in the UK, we screen every 3 years for breast cancer.
Okay. I thought it was mid-60s because I was still not born yet. So anyway, I will go back again to screening. What that consists of? What are you going to do? Is that screening what we do? Examine patients by clinic?
With breast screening, patients come along and they will have a mammogram of their breast. A mammogram is an X-ray, and the X-ray will take an image in 2 views or 2 positions, so that we can see the breast clearly.
Yes.
This does involve compressing the breast between the X-ray plate.
Yeah.
This is an uncomfortable procedure. This is not painful. This is uncomfortable. And there is only a small amount of radiation used.
Okay. Yes, this is a very good point, because in Egypt and Middle East, they have this concept that actually the X-ray, this means X-ray will lead to cancer. What do you think about it?
There is with any X-ray, there is always a small increased risk.
Yeah.
But we screen, in a few years ago, I have some statistics where we screened nearly 2 million women in the UK in one particular year.
Yeah.
And the chances of having a breast cancer induced from that is very small.
And background radiation we have everywhere is more than what we get
yes,
in the...
If you were to fly from, if we use the UK as an example, from the UK to Australia, you would have more background radiation than you would from a mammogram. So
you mentioned about mammograms. So this mammogram is not leading to breast cancer? Is not, if the patient has breast cancer, does it help to make it spread all over the breast?
No. A mammogram cannot make breast cancer spread at all. It will just show the area. The compression of the breast is tight, but if you were to lie on your side in bed, you would compress your breast more than we would ever compress.
Oh, thanks God it's not me. But anyway, what about the other questions you're asking me, that mammogram in general, what's the frequency we should do? I know the UK is 3 years, but other countries it varies. So what do you think about this?
It does vary tremendously. There is evidence in Ireland, for example, they screen every 2 years. In some other continental countries, they do 2 years. America is a little bit more extreme. They do yearly, but then patients pay for
money. Yes, we know that.
So,
Mr. Trump wants to get all the money from everybody.
We won't go political.
Yes, no.
But
yeah. So you do think 3 yearly is considered as the average, 2 years or 3 years?
Well, 3 yearly is adequate for the UK population.
Yeah.
But I think most countries maybe 2 years.
Okay.
So it would be looking at 2 to 3 years.
In Egypt, we are thinking, we usually say, inshallah, I mean, with God permission, that we want to do it from the age of 40. In UK, we do it 47, but this depends on research we're having here.
Yeah.
In Egypt, because we found that the cancer is getting earlier, we are doing this from the age of 40. Do you think this is a good idea if we are having evidence?
If you have evidence to suggest that you have many cancers from the age of 40, then you could start your breast screening program from then. There are, in America, for example, they do start screening younger.
Yeah.
We screen patients younger than 40 in the UK if they have a significant risk.
It's the family history, you mean?
Family history risk.
But again, not with the mammogram. We do other alternative things with regarding.
But we do mammograms.
Yeah. Okay. But MRI will be included as well in certain group.
Not routinely.
Yeah, but I mean, certain group of patients and all.
Dense breasts. Yeah.
So after we have the 2 views of the mammogram, the lady will come to have the 2 views of mammogram. I understand that all this will be saved in software among the screening program.
Yes, as you can see probably behind me, there are mammograms on a computer.
Which is digital.
These are saved in a patient archiving system.
Yeah.
So they're saved forever. And then if somebody comes on a regular basis, so if you did come every 2 to 3 years for your breast screening, we can look at the screening you had then with the screening that you had most recently and compare and see any small changes. Okay.
And if this screening mammogram showed any abnormalities, we'll recall the patient to come back for further assessment, either with mammogram, like compression or magnification view or whatever, or to merge this with an ultrasound or a biopsy if required.
Yes.
So do you think this will be a good way forward for the Egyptian and Middle Eastern to start screening program?
Yes, it would be very good.
I have to thank you very much, Joe, for this fantastic information, and I will translate it in another video to my colleagues back home in Egypt. I know that my colleagues will understand this, but I'm talking about orientation all over the Middle East. Thank you again. Thank you for your help in the department as well. Thank you. Bye.